Hello and welcome to the session of Widal test. In this video, we are going to discuss about the principle of this Widal test, what are the different procedures like slide Widal and the tube Widal, and how to interpret the test. Introduction. The Widal test is used to detect typhoid fever and paratyphoid fever. Typhoid fever is caused by the Salmonella enterica serotype typhi, and the paratyphoid fever is caused by the Salmonella enterica serotypes Paratyphi A, Paratyphi B, and Paratyphi C. The signs and symptoms of the typhoid fever are fever more than 37.5 degrees centigrade, which is typically step ladder pattern. Other non-specific symptoms like headache, weakness, loss of appetite, abdominal pain, diarrhea, vomiting, and complication include intestinal perforation. The incubation period for typhoid fever is 6 days to 30 days. Principle. The enteric fever occurs when the pathogenic microorganisms like Salmonella typhi, Salmonella paratyphi A and B infect the human body. During the course of the disease, the body responds to this antigenic stimulus by producing antibody whose titer rise slowly in early stages, then it reaches to maximum level and then it slowly falls till it is undetectable. Antibodies to Salmonella organism may be detected in the patient's serum from the second week of illness. Information regarding the titer, whether or not they are rising or falling, can be obtained by performing the serological test using the Widal antigen suspensions. The principle of this test is based on the antigen and antibody reaction producing agglutination. So, when the colored and smooth suspension of attenuated Widal antigen suspensions are incubated with the patient's serum, the anti-salmonella antibodies which are present in the patient's serum react with the antigen suspension to produce agglutination. Agglutination is a positive test result and it indicates the presence of salmonella antibodies in the patient's serum. No agglutination is a negative test result indicate the absence of salmonella antibodies in the patient's serum. Usually the tube titer of 1:80 and above are taken as a diagnostically significant. However, for endemic areas, the higher cutoff may need to be established. This is the picture showing the actual slide Widal. Here the O antigen, H antigen and paratyphi AH, BH and negative control and positive control can be seen. O antigen is a somatic antigen and H antigen is a flagellar antigen of bacteria. For the slide Widal, we have to add 1 drop of serum and 1 drop of antigen in the each circle on the slide. So in the first circle, we have to add 1 drop of serum and 1 drop of O antigen. In the second circle, we have to add 1 drop of serum and the 1 drop of H antigen. In the third circle, we have to add 1 drop of serum and 1 drop of AH antigen and BH antigen respectively. After adding the serum, the slide should be mixed in the shaker for 1 minute. After 1 minute, we have to observe the result. If agglutination is present, then the test is positive. So our qualitative test comes positive, then we can go for quantitative test. In the quantitative test, we have to do the serial dilution and we have to extract the exact number of the dilution where the agglutination is positive. So in the slide quantitative test, we have to add in the first circle serum 0.08 ml and 1 drop of antigen. In the second circle, we have to add serum 0.04 ml and 1 drop of antigen. In the third circle, we have to add serum 0.02 ml plus 1 drop of antigen. In the fourth circle, we have to add serum 0.01 ml and 1 drop of antigen. So this serum and antigen ratio gives the dilution following. In the first circle, the dilution is 1:40. Second circle, dilution is 1:80. In the third circle, dilution is 1:160. And in the fourth circle, the dilution is 1:320. So after 1 minute, observe the agglutination. Where the last agglutination is seen, that dilution is confirmed positive. Let's understand the tube Widal procedure. In the tube Widal procedure, we have to take 4 sets of 5 tubes for each antigen. For typhi O antigen, in the first tube add 1.9 ml normal saline and 0.1 ml serum. And in the rest of the 4 tubes, add 1 ml of the normal saline and transfer 1 ml from the first tube into the second tube, and again transfer from the second tube into the third tube, and so on. So this will give the dilution like 1:40, 1:80, 1:160 and 1:320. After doing the dilution, add 1 drop of antigen in each of the 4 tubes. Repeat this procedure for other 3 antigens like typhi H antigen, paratyphi AH and paratyphi BH antigen. After the adding, we have to incubate these tubes for 16 to 24 hours at a 37 degrees centigrade. And after the incubation, we have to read for the agglutination. This is the actual photograph showing the slide Widal and the tube Widal. Here you can see H antigen negative, H antigen positive, O antigen negative and O antigen positive result. Remarks: the positive result obtained in the slide should be confirmed with the tube test to establish whether the titers are diagnostically significant or not. The typhoid vaccinated patients may show high titer of antibody to each of antigens. Agglutinin usually appear by the end of the first week of infection, and if the blood sample is taken earlier, then it can give negative result. A rising titer is more significant than a single high titer. It is therefore necessary to evaluate 2 or more serum samples taken at 4 to 6 day interval after the onset of disease. While O antigen is a species specific and H antigen is a specific to serotype. Generally, antibody titers of 1:80 or more are considered clinically and diagnostically significant. However, the significant titer may vary from population to population and need to be established for each area. It is recommended that the result of the test should be correlated with the clinical finding to arrive at a final diagnosis. This is all about the Widal test. Hope you like it. Thank you and see you in the next video.